among African American ages 15 to 24. Me speaking for myself, I'm a 22 years of age and a Black male, and to know that I'm at risk, um, the top third things for me to be at risk at is suicide. It's a very scary thing. Um, the next thing I have is African American men are 4 more times likely to commit suicide than African American women alone. So now that we have me being a 22 year old male, Black male, African American male, and to know that the age of 15 to 24, I'm susceptible to suicide. But now it's a greater even impact of me being susceptible to suicide, because I'm 4 times more likely than my African American woman to commit suicide. And now
if I can piggyback off that to add another statistic for you. So being that I work in the medical field, I work in a hospital, and as I'm registering some patients that come through the emergency room for suicidal thoughts or mental breakdowns, the majority of them who are African American are. So you're saying, the 22 to 26, but a lot of them are moving up in age in terms of the generational struggles that they are exposed to, at an early age. So a lot of them that I'm seeing are now, you're saying 22 to 26, but now the numbers are dropping. You're seeing 10 to 16-year-olds. So most of that comes from, within talking to social workers, most of that comes from not being able or not being taught how to express yourself at that young of an age, because when you do, it's looked at as being disrespectful. It's viewed as being soft. So just to add to your point, in terms of the age bracket, yes, those are the most, I want to say the most current numbers in terms of that age bracket, but we're starting to see things younger and younger, and the effects of it is more of a reason why we need to start exposing our kids to awareness at an earlier age.
Definitely. So pretty much to reiterate what you were saying, so it really just stems down from the family household regarding mental health, and it's those areas, because as you grow older, you take those habits and those influences with you as you get older. But it's clear that depression and other mental illnesses are just as important for African Americans, particularly African American men, as for Americans in general as well. But ignoring these problems or pretending that they don't exist won't make them go away. And to me, I feel it's essential to know the signs and recognize the problems. So with that being said, as you were to reiterate what you were saying, I know everybody feels down and sad occasionally, but these feelings usually pass within a few days. When feelings of sadness, worry, hopelessness last for weeks at a time and affect your ability to manage your daily life, you may be experiencing serious depression. I know that can maybe from to a divorce to family, just general family issues, to those that may have a problem finding employment, just things of all kinds of natures, of can cause serious depression, just depending on how it triggers an individual. So one thing I would also like to discuss are what are some of the barriers or circumstances that cause the likelihood of mental health illnesses. Social circumstances can determine different types of mental health illnesses, are just the likelihood of developing a mental health illness. African Americans are likely to experience economic distress, racism, and other social circumstances that increases their chances of mental health illnesses. Access to adequate treatment for mental health problems can be difficult for African Americans for the following reasons. And these really, I sat back and I really just analyzed and just thought of it personally, how it could correlate to me. And some of it actually is it correlates to me and some people that I've just spoken to. One, African Americans are less likely to have health insurance. Two, African Americans are less likely to receive an accurate mental health diagnosis, and for those who are diagnosed with depression, are less likely to receive a treatment. Cultural mistrust of mental health professionals and healthcare professionals in general is common in the African American community. I know personally, I've heard, "Oh, I'm not going to a psychologist to have them evaluate me and make me feel like I'm crazy, or I don't believe I should go." Just in the health profession, uh, you hear just in the family household, "Oh, I don't believe in going to the doctors. I go to the doctor, it's something worse than what I thought, but that you need to go. You need to go." Um, only a small proportion of mental health professionals are African American, and some African Americans in the Black community feel like, why should I feel like I need to go to someone that is not like me, that can't relate to my struggles, or in that aspect. What can we do? Historically, African Americans have relied on religious and social communities for emotional support. That's one of the reasons for the Brother in Your Mind initiative, making faith and social communities more aware of the mental illnesses that members face will help these groups support their members, encourage African Americans to acknowledge their own needs, and provide resources for members who need help that the community alone can't give. Some organizations that I listed that can be very influential and supportive in overturning mental health illness um, is the National Institute on Minority Health and Health Disparities, the National Institute of Mental Health, the U.S. Center for Disease Control and Prevention, Substance Abuse and Mental Health Services Administration, the National Alliance on Mental Illness, and finally, Mental Health America, following the National Black Nurses Association. Um, those are some organizations that I feel like that those that have these problems can seek out and get the support they need. But if a person doesn't feel comfortable, reaching out to these associations, I feel like they don't have the means or a way to reach to these organizations. Just honestly, just seek out mental health support just from those around you, because you really are only a product of your environment. You don't need to contain everything in. You need to let everything out. And those that really around you, they can kind of they can guide you on what
But if
certain
I can
things.
add on to your point, in terms of speaking of those who are around you, it's good to have a strong core around you who encourage each other to communicate. I feel like the biggest issue that we have is communicating ourselves, communicating our feelings, because sometimes we might simply not be able to find the right words, or we're worried that the words we might use may be judgmental. So if you have those questions with those who are around you, you might need to change your support group, because me personally, I have a select few people that I can call and say, "Hey, listen, this is how I feel. What should I do about it?" Sometimes you need a first, second, and third opinion, but it really breaks down to who you have around you in terms of communication. If you can openly communicate your feelings, your thoughts, and your minded ideologies, that really is the biggest barrier of them all.
Definitely. But to conclude this presentation, I would like to introduce our the 41st Grand Boss List, Dr. David Marion, to tell you a little bit more about Grand Boss List, David Marion. He is the owner of Marion Counseling Services, a mental health clinic that specializes in providing individual, group, marital, or couple and family counseling, psychological evaluations, psychiatric evaluations, and employee assistance programs to organizations throughout the state of Mississippi. He has been in the counseling field since 1992 and in private practice since 1998. He holds a PhD in counselor education with a minor in public administration and public policy from Mississippi State University, a master's degree in rehabilitation counseling from Mississippi State University, a bachelor's degree in business administration from Jackson State University. With that being said, I would like to introduce Grand Bosses David Marion.
I appreciate the introduction. You all are doing some outstanding things on this call. I was touched by the various comments. I was just on the phone with folks who work with the National Institute of Minority Health and Health Disparities this afternoon. And they were asking me what was the Omega Psi Phi Fraternity continuing to do in its efforts with the Brother You're on My Mind program. And so I mentioned that this programming that you have here today was going on, and they were extremely impressed and moved by young Black men coming together to talk about mental illness, the signs and symptoms of mental illness, and the resources and places where you can go get help. And I think you've also done a lot of what the objective of the Brother You're on My Mind program is about. I was fortunate to be able to start this program under Grand Basileus Tony Knox in 2014. And we made a trip to the National Institute of Minority Health and Health Disparities, told them what we wanted to do, and they have joined us in that effort over the last 6 years. And the objective was to reduce the stigma attached to mental illness and the stigma attached to going to get help for mental illness. And our target audience was African American men. And so to see African American men talk about this here tonight is such a beautiful thing. That's why you're having a few technical difficulties, because you're trying to talk about some good stuff, and all of a sudden, coincidentally, your live feed goes out. You know what I mean? So you got to keep grinding through, though, and I love the way you brothers did that. And so the way we executed the Brother You're on My Mind program was to first take it to our chapter brothers, do so in chapter meetings, and talk about, again, the signs and symptoms of mental illness and where you can go get help. And then take it out to the communities, because what's important is not, there's no shame in going to get help. The shame is knowing you need help and not going to get it. And so what you all are doing is taking some of that shame out for Black folks. You've talked about disorders like depression, but there are families of other disorders, neurodevelopmental disorders like ADHD and autism, anxiety disorders like panic disorder and PTSD. We often see PTSD with our brothers that have served in the military and come back, and they've seen things and done things that it's hard for their mind and their heart to wrap their arms around. And so they come back reliving some of those traumatic experiences from whence they came. PTSD is an interesting disorder, because PTSD doesn't necessarily have to be something that you did or something that happened to you. It could be something that you've seen, that you saw with your own eyes was very traumatic. So we see folks who witnessed somebody get gunned down, a family member, or went into house to wake Big Mama and Big Mama was gone. And so there's some traumatic things that some of us as children and teenagers and young adults can't seem to escape from. And that should bring up to mind what we saw and what we've heard about recently with the killing of Breonna Taylor in her own apartment, in her own bed. Imagine that, you're asleep and you die. Imagine you're jogging with Ahmaud Arbery, and like back in the days of slavery, when white folks would track you down, here are men in a truck tracking you down for several minutes, to finally you decide, you know what, enough running, I'm gonna fight, and you lose your life. You saw Rashard Brooks die in Atlanta, where it's amazing that folks don't know how to use the taser anymore. When they shoot at us, they shoot to kill. And then, of course, you saw George Floyd with the callous way in which the police officer put his knee on Brother Floyd's neck for 8 minutes and 46 seconds. with his left hand in his pocket, almost like he was out hunting and had killed a deer. And that's exactly the stance that you would take. Those are traumatic images that have impacted African Americans for decades. When I saw George Floyd, I thought about Emmett Till in 1955, coming to Mississippi to visit family and accused of flirting with a white woman. And men late at night went to his house, dragged him out of his house, made him carry a 75-pound cotton gin to the river, made him strip down butt naked, and they beat him almost to death. And then they gouged one of his eyes out, shot him in the head, tied him to the 75-pound gin with barbed wire, and threw him in the river. 14 years old. Imagine the trauma that our people have endured over time. And one of the things I think that people don't appreciate about disorders like what I've talked about, PTSD, anxiety, depression, neurodevelopmental, eating disorders, personality disorders, psychotic disorders, schizophrenia, is there is a genetic piece to these disorders. So one of the questions we ask when you come to see us is, do you have a family history of mental illness? Do you have a family history of substance abuse? Because when you have those kind of genes and come from those kind of homes, it takes some effort to kind of not act out the same way. And so the program that you're talking about and the resources that you can go and get help are enormous. It's one of the reasons why I went into the mental health field. I thought that when my people were courageous enough to make it to a counselor's office, they did not need the issue of race to prevent them from seeking help. And so I thought if you had the courage to come through that door and you saw a person like me sitting in the chair, that would make you feel at home and you'd feel free to talk about things as you felt free to talk about them. You follow what I'm saying? You didn't have to filter it and shape it up any. You can talk like you talk at the house and in the street, and we can get down and dirty with it, and we can get you to a better place. Because in my doing this for 28 years, my job in counseling is I do something called cognitive therapy. And so what I do is when a person brings to me a situation, I try to help them look at the situation a little differently. Because if I can change the way you think, I can help you change how you feel. And if you can change how you feel, you can change how you behave. And so that becomes my job kind of in the counseling session. And people are often worried about what that experience is like. But in your personal life, if you think about it, you do have people that you go and talk to. You just have people that you bounce ideas off of. You have people in your life when life gets a little overwhelming and throws you a curveball. It may be, mom and them. It may be an old friend. It may be a line brother. You know what I mean? That you have a real close relationship and y'all have shared some personal stuff and they haven't told anybody. Because that's the beauty about counseling, is that we can't tell anybody unless we get releases and all that kind of stuff. What you tell us stays with us for the most part because it's by law, it's HIPAA. And so we keep that to ourselves, and then we don't judge you. If you come on one of the worst days of your life and you're hurting, the last thing you need from a counselor is judgment. And so sometimes you're fortunate enough to have people in your life that can serve in that purpose. But there are other times, no matter who you know, they just don't have the expertise to get you to where you need to get. And so that's where licensed professional counselors, licensed marriage and family therapists, licensed clinical social workers, licensed psychologists, licensed psychiatrists, that's where these people have done some schooling and have done some work and some training that should give you the confidence that I can go and talk to them. And I think that's the purpose of counseling.
And Brother Grant, excuse me if I can, since you're on the subject of counseling, a question that I feel that popped up since you're on the topic that fits what you're speaking about. It says, what are some of the misconceptions on the cost of mental health counseling and treatment? So, addressing that is within the misconception that it is when people seek any type of help especially with the word professional, license, along those adjectives, the first thing that money asks, well, how much is it going to cost? So in terms of that thinking, what do you think should be the breakdown when it comes to that misconception?
Well, I would say insurance covers most counseling sessions. So if you have insurance either through a parent or through a job that you have, there should be some coverage in there for mental health services. I would say in every state, there is something called local mental health, and you'll have a local mental health agency that was created by state government to provide counseling for those who may not have insurance. And so they'll have what's called a sliding fee. And that fee is based on your income. So if your income is little to nothing, you can still receive services. Even in the private practice that I have with my wife, we have a sliding fee. And so if you are a young African American child in the Jackson Public School District here in Jackson, Mississippi, and you have no insurance, we still see you. We still provide services to you, and we try to work hard through case managers to help you become insured. So people should always realize that. I think also they should appreciate that in some cases, the assessment might not be a charge. So in other words, you're just going to someone to get a quick idea of, do they think that they need help? In other cases where there is a charge, again, it should be covered by your insurance or by a sliding fee.
Thank you for that, brother Grand Marion. I also have a question for you as well. So regarding just the African American community, or just the minority community, what do you feel causes the misdiagnosis or the overdiagnosis of mental illness regarding minorities?
Well, I don't know if I would say there is an overdiagnosis, because just like African Americans have a history of and I should say some, this is, I think, one of those things that we have to continue to look at to see if it is a myth. But I know when I was growing up, Black folks were scared to go to a medical doctor. And so I think that was the point you were making earlier, that, and so by the time they went to a medical doctor, then hell, they were dying then, so they could have went earlier and possibly caught this early on, but they waited and waited. And we have a great a pain tolerance. So, if our leg is hurting, we just go on to work, keep moving. If our head is hurting, we just keep going. We keep going. If we're sad and tearful, we just keep going. And so because our mental illness is not raised to the level that depression can sometimes get, when you can't go to work, when you can't get out of bed, when you don't want to brush your teeth and brush your hair, it hasn't become that incapacitating, then we'll endure it. But it gets worse if untreated. And so we have to be, I think, very careful about that. So I think that African American, our history is that we have not been so inclined to go to a doctor when we feel an ache or a pain. But likewise, I think because of the spirit of, I can do it on my own. After all my people have gone through, I should be able to endure this, because of how people have made going to get help like crazy, like you brought up. Then people are less inclined to go and talk to someone. In my private practice, I'm yet to see somebody who's crazy. What I see people are people who are hurting, people who are overwhelmed, people that are hopeless. And Martin Luther King said, once you stop hoping, you die. And that's not a physical death, that's a spiritual death. And so in counseling, my job is to meet people spiritually where they are and try to get them to a better place. So I think there is a lot of misdiagnosis with children, though, when it comes to ADHD, because I think children can get those diagnoses so quick at schools. And a lot of African Americans and other races will go to a medical doctor to talk about their mental illness and other symptoms that they have before they go to someone like me. So you go to the medical doctor and you get medication from a person whose expertise is not mental health. But you're getting that medication anyway. You know what I'm saying? So I think we have to choose experts in the field to treat the problems that we're talking about.
Okay, and Brother Graham, before I move on to my next question, those who are watching on via Facebook and YouTube, you can post comments you may have, and we see those comments. And if there are any questions that we do see, we will pose them to Brother Graham or whomever you see fit to answer said question. So, Brother Grant, as just to piggyback, it's funny, your words are linking right into my questions. So, my next question for you is, how would you feel the awareness of mental health in the African American community can be improved, starting at the ages where you have the nurture versus nature? And the example that I want to give you so you can kind of get a spectrum of what I mean. So, for me, when I was younger, my family bounced around a lot. And after we went from a 4-family in a 2-family house, we went from a 2-family and 2-family house to just me and my mom. So between that transition and then going from an education system in one town for 5 years, having to adjust to another one, at this point, I was at the age of 9 or 10. Now, at the time, I didn't realize what it was because obviously I wasn't educated, nor did my parents and grandparents educate me in the field, because growing up in the African American community is no room for emotions. There's no room to be sad. You kind of take what you're taking, take what you deal, and keep it pushing. So how do we, moving forward, those of my generation who are becoming parents, or just those who may still be parents and who want to fix things before it gets too late, how do you suggest they go about that from a nurture standpoint, where it doesn't seem too much as of a, I want to say, being dictative?
I think that we have to have conversations about mental health and the signs and symptoms of mental illness, and where to go to get help. And there's no shame in going to get help, no shame in having this diagnosis with our children, just like we have conversations with them about sex, about how to survive a traffic stop. So these are the conversations that we have to have, because if we don't have them, they're going to learn about them in other ways. And so I'd rather them be taught. For example, and we can either be taught right or taught wrong. You know what I mean? So just like I've never heard my father tell me how to survive a traffic stop, but I've heard the men of Omega tell me how. And so just today, I'm on my way to work and a police car gets behind me. And so guess what? I'm playing the tapes. You know what I mean? Okay, if I get pulled over, you haven't done anything, so don't get crazy. Put your hands on the steering wheel. So all that, that's going through. Well, that's Omega men teaching me something. And so I think it is my job, in terms of being a responsible parent, that I teach my children that feelings are not right or wrong. That we're going to talk about feelings just as much as we talk about anything else. Having feelings doesn't make you weak, doesn't make you less than a man. But it's important for me to know what's going on in your head and in your heart, so that I can determine if I'm still fit to do the job to help you. You follow what I'm saying? These kids nowadays know more about depression, bipolar disorder, anxiety, eating. They know all about that through social media, through Facebook and Instagram. People are posting stuff out there all the time. My 11-year-old was talking about the movie 13 Reasons Why a week ago. And so, this is a movie about someone who committed suicide, and so you have that. So now if they're seeing that, if themselves and their friends are talking about that, then it seems like the responsibility on us is on us to talk about that as well. One of the diagnoses that you spoke about just then is called adjustment disorder. And what that is that you can have an adjustment disorder with a depressed mood, adjustment disorder with an anxious mood or with anxiety, adjustment disorder with problems or disturbance of conduct, adjustment disorder with a mixture of that. And so what that simply means is that there has been a stressor or a traumatic event, something significant has occurred that has caused you great stress, and you are having problems adjusting to it. You are having problems making peace with it. And so because of that, after it lasts for a certain period of time, and after you meet the criteria for that diagnosis. So that what you just talked about is real.
Thank you for that, Brother Grant. I have a question from a respective viewer that's watching the live. The question is, how can we as African American women offer support to the men in our life / community without sounding judgmental and or as if we are questioning their masculinity / kingship?
I would say through programs like this, letting them see other African American men talk about mental illness. We don't see this that we're doing right now is so unique. You don't see this. Think about, when have you ever seen a group of Black men talk about mental illness? You heard the brother talk about growing up and some of the difficulties and the various moves and living here and there and being in different school districts and trying to make those adjustments without whining about it, without complaining about it, and internalizing all of his feelings. When do we hear men talk about that? You ask a man how he's feeling, I'm cool, I'm good, I'm fine. You've never heard a man say, hey, how you feeling, man? I'm feeling inadequate. You know what I'm saying? You know, man, I'm scared. You know, man, I don't have a lot of confidence today. You don't hear, I'm sad, I'm hurting. You don't hear those kind of words from men. And we feel all of that, but we pretend that we don't. And so to African American women, I think the objective is to educate their man in a way through other men, and educate him through the experience of letting him know that however he feels, you're not going to judge him for it. You're not going to think less of him for that. You know what I'm saying? And some women don't have that kind of tact. You know, a man is getting a little emotional or crying about something. What you crying for? Be a man. You know, those kinds of things. He's a human first. And human beings are going to hurt. They're going to be disappointed. They're going to get frustrated. They're going to get overwhelmed. They're going to get angry. And so I think for the woman that asked that question, help him remember his humanity, and that you want him to be real. And in fact, that's what makes you love him so, is not the pretense, but what's real about it.
Brother Grant, our last question from you is from, seems to be a member of our beautiful organization. So his question is, since the inception of Brother You're on My Mind, has the program seen a measured level of success?
Oh, I would say so. Over the last 6 years, first year we had the program, we had we recognized there were brothers that committed suicide. We recognize family members going through this. We've done a Brother You're on My Mind initiative at every international meeting. Brothers are now talking about mental illness more, just like we're having this conversation. We're talking about mental illness more, where to get help. We measure that through the surveys that we take in terms of the programming that we do at the community. How many brothers participated in the mental health workshop at their meeting? How many Omega men have taken the pledge? We actually have a Brother You're on My Mind pledge, where we pledge to treat each other as friends and as brothers. We pledge to look out for one another. We have certain chapters that know the brothers in their chapter that take medications for mental illness, and they have folks that they can be accountable to. We have brothers who have taken another brother to an assessment, went with him to the assessment, so that he can have some company and some support as he goes to see if he does have a mental illness. We have those stories come in all the time. We have a Brother You're on My Mind challenge right now that I challenge all the brothers of the Omega Psi Phi Fraternity, where I ask them to call 4 brothers every Wednesday, not to do Omega gossip, not to talk about Omega politics or Omega business. Call them and tell them that you love them. Call them to tell them that you wanted to see how their family was doing. Call them and let them know, brother, I'm just calling you because you were on my mind. And so we have seen the powerful impact that has had on our brothers.
So, Brother Grant, personally, myself, on behalf of the Mighty Second District, which is, I want to say, a second home for you,
Yes,
we want to say thank you for your time. I appreciate the information. And as I told you through email, I appreciate your availability. That's one thing I appreciate that you always have for anyone. You were never inaccessible. You never had yourself on a higher pedestal. And I know you said that was a personal thing to learn from your father, to be accessible. So thank you for that. That's something I'm instilling for myself. Brother Smith.
Thank you so much, brother.
Thank you, Brother Grant. I also, to reiterate on Brother Calhoun, with the courtesy of you coming on this live, it has actually had me sit back and just evaluate, just listen to what you were saying. It's actually helping me gain more of a more conceptualized way of looking at mental health, just not only as a Black man, but just as a human being. And I really appreciate it. Thank you so much.
You're very welcome, brother. Thanks for having me.
No problem. So, Brother Grant, if you have any last remarks before you head out of here and take on the rest of your evening, the floor is yours. We yield.
Well, I would just say again, there's no shame in getting a mental health diagnosis. No shame in getting help. Again, the shame is knowing you need help and not getting it. Sometimes in the sessions that I've conducted, I can remember many sessions where I didn't have to do a lot of talking to help folks. Sometimes folks just need to have the floor for that hour and talk themselves. Probably one of the most powerful sessions I ever did was a woman that had been raped 2 decades earlier and had gone to many counselors and had not found a lot of success. I was her last resort. And so she came in and she talked and she talked and she talked. And at the end, she said, that was the best counseling session I've ever been in. And after she left, I assessed. I said, I wonder what I did that was so powerful and so right for her. And I found out that I had not said a word. So sometimes you can just walk with a person along their path that they're on and just let them know that you're here. Let them know that they have your undivided attention. Let them know you're not going to judge what they say. Let them know you're going to keep what they say in confidence. And let them know that they're believed in that room with you and you're there to help them. And I've been in this helping business now 28 years. And I tell you, there is no other career I would want. So thanks again for letting me be on.
No problem. And just a comment that came from Tyrone Relford. He said, keep leading, Brother Grant. So it's something you should know. We are behind you. So
Thanks so much.
As we move on to the next portion of our segment, the client, we can do a name for name. I'm not sure how many names Paul wanted to do for a gift card giveaway. So, Brother Grant, we're going to do $25 electronic gift card giveaways. We're going to pick names from the feed, and what they have to do from the feed is the message the fraternity's page directly with their information, the full name and email address. And they will receive the gift card from there. So, Laquan, we could go, I pick one, you pick one, and if Paul says we can pick another from there, we can just keep it going. So I'm going to pick Tamaja Sutherland from the Facebook feed. So Tamaja Sutherland, what you would do, you would message the page with your full name and email address, and the directions will come from there. So Daquan, you can pick yours next.
I would like to choose Denise Trimble Smith. If you could direct message the fraternity's Facebook page that we're hosting this live on, it'd be greatly appreciated as well.
The next name, we're taking Sophia K. Franklin. You can follow the same suit, message the fraternity's page directly, the same one from the live feed. Just put your name and your email address.
I would like to give a gift card to Mr. Norris Taylor. If you could also direct message the fraternity's main page, would be greatly appreciated.
And the last giveaway, Edward Lynham. Hopefully I'm not pronouncing that last name wrong, but Edward Lynham, the last name is spelled Lynum. So closing remarks, I'd like to invite Brother Second Vice Grand Austin Tatum back.
And Deshaun, how much are you going to give them?
They're each $25.
All right, so we're going to double it up for the night. Each of them will get $50.
All right, so you all get two.
Brand got style.
Yes, sir. If you're going to do it, you got to do it big, as my current D. Kelvin and Popo says.
Well, Brother Deshaun and Brother Quan, you all each did an amazing job. I appreciate you, brothers, for your leadership as Second Vice District Representative, and to our 41st Grand Bosses, Brother David, Marion, we really appreciate you. Your accessibility, your leadership has been outstanding in the ways you have progressed this fraternity and represented this fraternity. You're truly a friend, a mentor, and a great brother. To all our guests, we really appreciate you and hope you have a wonderful evening. Thank you.